On 5 News tonight, are care homes heading for another crisis? After the horrors of the spring, bosses say lessons aren't being learned.
I am unaware of the plans on what's going to happen if we should hit a second wave.
I have no confidence that the government is going to have our back.
A severe lack of staff, major delays in testing. Is the protective ring falling apart? And now a new problem. Empty beds have doubled, putting homes at risk of closure.
Being brutally honest, if things don't improve, then we would have to look at the future of the care home and whether it's financially viable going forward.
We'll hear how staff have adapted, how residents have coped, and how relatives have dealt with losing a loved one. And I'll put your questions to those in charge. That's tonight on COVID Care Home Crisis. What now? Welcome to this special 5 News Tonight programme, live from Wren Hall Nursing Home in Nottingham. This is just one of the many thousands of care homes dotted across the UK, which are home to a total of more than 400,000 residents. They offer a bed, meals, medical help, and, just as importantly, friendship, safety, sanctuary. When the pandemic swept the country, that sanctuary was shattered. 20,000 care home residents died with COVID. Many more died as an indirect result. That unwelcome phrase, excess deaths, is now a part of our common language. The causes have been well documented. Tonight we ask, have the lessons been learned? Or could homes be at the mercy of another crisis this winter? We want to hear your stories and the questions you want to be answered. First, Julian Drucker reports on the state of our care homes.
Morning, June.
Not one.
How are you?
Amid the fears of a second wave, the memories and the devastation of the first one still linger.
You know, after the virus, he's coming to see what it's like if we're back to normal.
Oh, we're trying, aren't we?
Which are trying, aren't we?
Anita Astle saw almost a quarter of her residents die of COVID-19 at the height of the pandemic. She feels she still doesn't have the support of ministers should things get worse.
We really suffered in the first wave. The guidance that's come out around visitors is not what we'd want it to be. And so I have no confidence that the government is going to have our back or, as Matt Hancock said, provide the ring of steel around care homes.
This is our isolation area.
In April, we highlighted the struggles Wren Hall Nursing Home was enduring. In lockdown, Anita filmed these pictures of their so-called red zone, where residents with suspected symptoms had to isolate. 13 would eventually die. As things are gradually restored to normal, Anita has now allowed us to film inside the home.
These are normal bedrooms now, and the lounge area has returned to what we call Garden Row to look after those people.
These days, there are no shortages of PPE.
Ray, you'll just wash your hands. Just give your hands a little wash, ready for dinner.
And there's never been a lack of TLC.
Ready?
We've also been in contact with staff at Tregwilym Lodge Care Home in Newport, South Wales. Here, they lost so many so quickly. At the time of the first wave, the advice in Wales was to only test those with symptoms. They now believe 21 deaths can be linked to COVID-19.
I am unaware of the plans on what's going to happen if we should hit a second wave. So there's been no engagement in respect of whether we're going to have extra staff, whether we've got enough PPE in the system, the flu jabs in respect of our staff and everyone making sure we're covered. And that's quite worrying as we move into August. And dependent on when the flu season hits or the second wave hits, if we get one, then clearly that is also a very worrying time.
Can I take your temperature? future.
But it's staffing that's the most worrying and pressing issue at a group of care homes in Norfolk.
You've got a cold head today.
The sector is drastically short of staff as some temporary workers have returned to reopened bars and restaurants. Jasmine, who usually works in human resources, is now providing care.
Full PPE on, as you can see. I have to wear the mask at all times during the time that I'm in the home. Got a little bit of rash on my face here and on the edge of my nose. It's okay, I'm getting a bit tired. I've been on my feet, haven't had a chance to have a break yet. And to be honest, given that I've only done shadow shifts so far and I didn't really manage to get a break on those, I don't really reckon I'll get one today.
Back at Wren Hall and in so many other care homes, testing remains a huge problem. The government promised staff would get a COVID-19 test every week, residents every month. But Anita has been waiting 3 weeks for the testing kits to arrive.
So you can't even sort of meet the government guidance about testing residents and staff because you just don't have the kit here?
No, we don't have the kit and we can't get them.
And how frustrating is that?
It's really frustrating because we want to keep everybody safe, particularly because of asymptomatic transmission. We don't know who's got the virus or not. So the only proactive way of managing this is to test people regularly.
Downing Street has acknowledged what they've described as unexpected delays in the testing programme. Many improvements have been made since the horrors of the spring. The autumn, the winter may bring new challenges. Julian Drucker, 5 News.
We would like to hear the questions you want answered. Has a relative of yours been in a care home during the pandemic? Does one live in a home now? Or perhaps you're facing that possibility in the near future. What concerns do you have? Let us know. You can get in touch by heading to our Facebook page, search for C5 News, or you can message us on Twitter. Use the hashtag COVID Care Home Crisis. The details are on your screen now, and we'll put your questions to the National Care Association at the end of the show. First, 5 News has discovered that many care homes are at risk of going out of business because of a shortage of patients. We surveyed hundreds of homes across England. The results show that the number of empty beds has nearly doubled in the past year. Eric is 88 and after weeks confined to his room during lockdown, he's thriving on a return to normality. But there are fewer residents in his West Yorkshire care home to enjoy the activities with. Half of the 68 beds are vacant.
So this is one of the empty rooms that we have at the moment. It's been empty 7-8 weeks now.
9 residents passed away in March and April. 2 tested positive for COVID. But that alone doesn't explain the situation. Deaths in the community mean fewer elderly people to admit. There's lower demand for post-hospital care because surgeries have been cancelled and some relatives are worried about safety.
The inquiries I've had from families wanting, a room for their loved ones, that's the question they ask. Have you had anybody with COVID? Do you have COVID in the home now?
We surveyed care homes to get a snapshot of the situation across England. The 256 providers who gave us full responses have a total of 9,735 beds. In June 2019, 1,281 were empty. In June this year, that number was 2,404. It's almost doubled. The average occupancy rate for the homes we surveyed was 92% last June. It dropped to 81% this year. 15 homes like this one were less than half full in June, and the financial impact is huge. This home is currently losing around £8,000 a week in income, but they've still got most of the same fixed costs. There's a mortgage, a building to run, staff to pay, and for the foreseeable future, extra costs in PPE and cleaning products. They're being pushed to the brink. It's an anxious time for the owner.
Being brutally honest, if things don't improve, then we would have to look at the future of the care home and whether it's financially viable going forward. That would be a last resort. We've got currently we have 34 people who live here. It's their home, and you know, if we had to make a decision to close, I know I'd be pretty devastated.
60% of the residents here are funded by the local authority. They have increased payments by 10%, but it's not covering the empty beds. The organisation that represents local authorities blames a legacy of underfunding from national government.
The pandemic has absolutely brought it to a knife edge because we were having problems in this sector to start with. The councils have not been given the funding to support social care, adult social care, and in the care home sector. So we can't help them within the councils. But if we had a proper funding mechanism, we'd be able to do that.
There you go. They have been clear of COVID here for many weeks. They're ready to welcome more residents safely and desperate to keep people like Eric happy in the place they call home. The question is how long they can afford to do so. Well, we asked for a government minister to come on the show to address the issues we've raised. They didn't put one forward, unfortunately. However, we were given a statement. It says, throughout the pandemic, we have been working closely with the sector and public health experts to put in place guidance and support for adult social care, including testing all residents and staff, funding a care home support package worth £600 million and making a further £3.7 billion available to councils to address pressures caused by the pandemic. Let's speak to our political editor, Andy Bell in Westminster. Andy, the government says it's doing everything it can to support the social care sector, but we are still hearing there are plenty of concerns. Do you get a sense that the government is on top of the issue?
Well, Tessa, I certainly think they are much more focused on it than they have been in previous months. That because they know a lot of people believe they simply took their eye off the ball when it came to care homes at the beginning of this crisis, particularly when it came to transferring people from hospital to care homes without testing them. So now the government is stressing the money that they say they're putting into this. They say the financial settlement for local government to be able to provide adult social care is the most generous offer there has been in a decade, and they are making that offer of testing as well, that all residents and staff in care homes should be regularly tested. But as we've heard in Julian's report, the timetable on that has been slipping. The chair of the National Care Association has said it's disgraceful the way that the testing is not happening as it's supposed to. So I think there are a couple of things the government has really got to get right now. One is, if we do have a resurgence of coronavirus and they need to free up hospital beds, they are absolutely going to have to test anyone who is transferred from a hospital bed to a care home, which is not what happened before. And secondly, they have to come up with a long-term solution to fix the funding of social care, of adult social care. The government says it's working on a plan to do that, and they'll be able to present that to the country quite soon.
Thanks, Andy. Well, let's get reaction to what we've been talking about now. I'm joined by Damien Mann, who's a nurse here at Wren Hall, and Joyce Pinfield, who's from the National Care Association, which represents around 700 small and medium-sized care home providers. Damien, I'd like to chat to you first. You worked for a long time in that red zone that we saw in Julian's report, didn't you?
Yeah.
How does it feel now when you reflect on those really tough times?
I think after working on autopilot for a long period of time and then having to come back to the norm, it's hard to process the feelings, and I think that's what a lot of the people have struggled with, the things that they've seen and what they've had to go through. And the loss of life has been a major thing that we don't see very often. And so processing that whilst acclimatising back to the norm is something that is really hard at the moment.
And it's not really normal that you've come back to now, is it?
No, so everyone's still wearing the PPE, social distancing is still in place, visitors aren't allowed at the moment. So given the support, it probably makes our support to the people that live here a lot more important as they can't see the family.
How hard was it for you trying to balance your work here with your own family life at home during the pandemic?
Well, I've got two small children, both under 7. Luckily my partner Chloe, she was off work, so she was able to look after them, but them being together all the time probably made me feel a bit more isolated because I was so focused on work. But the support network that I have at home enabled me to do that, to be here for the people that we look after.
Joyce, I wonder if I could bring you in now. Damien is exactly the kind of people we need working in this sector, but there are real fears, aren't there, that there's a shortage of care workers?
Yes, Damien is precisely the type of worker that we need in social care. We went into this pandemic with already about 120,000 vacancies in the social care sector. And indeed, we need even more social care workers now. Where we're going to find them from, we're not too sure. But Damien is precisely the sort of person that we are looking for to work with our most vulnerable people.
We were talking about occupancy rates during one of the pieces then. Is that a really big concern for your members?
It has, over the last few months, become a major concern. Viability has been a problem for many years now because the fees have been on a downward trend for at least 10 years. And so already the care services were overstretched. We have great problems trying to get the workforce, as I've just mentioned. And so the viability is even more stretched now because so many care homes have got occupancy problems, not only because of having COVID deaths within their services, because after all, the majority of our services have not had COVID within their homes, but also due to natural people going home after respites and natural end of life.
If a home does close, there's clearly a huge impact on the staff who work there, which is a worry, but the residents too. What can you tell us about that?
Our residents, you have to remember that care homes are what they say they are. They are homes. They are homes to our residents. And so it is their total way of life and their security. And if a home closes and they have to move to another care facility, the trauma that they can suffer, they may not survive that trauma of a change. They are so used to the carers, they're used to the environment, and of course they are very vulnerable. Many are very frail, and of course we do have people with dementia, so the trauma of actually moving home would be a tremendous problem for all of them.
I'm interested to know from you, Damien, as a care worker, not one of the bosses, not someone who's in charge of the finances, but what do you make of what the government says? They've made a £600 million support fund available. They're putting their protective ring around you. Do you buy it?
No, not really. I believe that it was a last thought. I believe that the aftercare package that they put in place is rushed and not well thought through. And what people have to remember is that even though the people are taken away from their families, they create new bonds here, they create friends here, and this is their normality, and this is where they live. And the importance is that put at the front of everything, I don't think.
All right, well said. Damien, Joyce, thank you very much for joining us. Coming up on this 5 News Tonight special programme, we'll put your questions to the National Care Association and we'll hear the stories of staff, residents and loved ones who've endured the horrors of the pandemic. We'll see you after the break. Hello and welcome back to this 5 News Tonight special programme. During the pandemic, almost half of care homes in England experienced a COVID outbreak. The implications were huge. Many residents had to stay in their rooms. They lost friends and so did staff. And families, of course, lost loved ones. At St Cecilia's nursing home in Scarborough, coronavirus arrived in late March. Of the 10 deaths that occurred there, 4 have been attributed to the virus. We've been speaking to staff who nursed those people, a resident who's been stuck indoors, and to the husband of a woman who died.
My name's Susan Thorlbeck and I live at St Cecilia's in Scarborough for 3 years. Not seeing people, your family, was heartbreaking really. Just being in your room, 4 walls, another TV to keep you company. I missed all the visitors, my grandchildren. They've been smashing, the girls. Really good. Very caring as well they are. But people have been very lonely. I think that's the worst thing.
My name's Reg Kemp and I'm the husband of Liz Kemp, who was a resident in St Cecilia's nursing home for 3.5 years before she died of the coronavirus. The awful thing was not being able to visit, and then wondering what she was thinking. And this is what I'll never know, you see, because she had dementia. She was in good hands, I know that. But I just hope she didn't feel we'd let her down in any way.
I'm Alison, and I'm a team leader at St Cecilia's Nursing Home.
And I'm Leslie, I'm part of the St Cecilia team, and I've been looking after the COVID patients and all the other residents.
You know, we were all frightened as well. You know, we didn't understand what was going on. I don't think anybody did initially.
I was with a resident 5 minutes before she passed away. You can't give them the end-of-life care that they usually get. You can't sit and hold their hand and stroke their hair and sing. You can sing to them, like, you know, that we do with our residents, but you can't comfort them the way we did before.
And to suddenly lose somebody you've spent the last 2-3 years loving is horrendous. It's the same with any end-of-life care, but this has been, some of these have been snatched from us. You know, it's not even fair. It's just not fair.
Simon, the nurse, rang me and said, I think you ought to pop up and see Liz. We'll allow you in. They put me gloves on and things on my feet and an apron and mask and everything. I'm sure she knew who I was, but she couldn't speak. So I just chatted to her like as normally as I could. That was rather upsetting, but I am so pleased that they allowed me to go and see her. It was about 9 o'clock at night and Simon rang to say she'd passed away, and that was that.
I've coped. I think you've got to, haven't you? The most important thing I'm looking forward to when things are back to normal is going out and going shopping, treating myself, and seeing my grandchildren.
I've never probably felt as angry about this illness as what I should do, and I don't know why really. I feel positive about our life together, which was a good one in a long time. She said to me one day, you know, you and me have been a good team. Yeah. I do miss coming to see her, and I miss seeing all the staff, and well, I don't call them staff, they're family. I can't praise them enough. You know, they're wonderful, all of them, really. Every single one of them.
Some powerful reflections there. Now, some staff working in care homes only joined recently, having worked in entirely different sectors. The training's basic, but the tasks they end up having to perform can be anything but. One worker who wanted to remain anonymous told us about one particularly difficult night that he and his colleague faced on shift.
3 months ago, both of us were working in the tourist or travel industry. Now we're on the front line caring for people considered fit for discharge from hospital, but not well enough to go home. We have no medical training, and before we were released onto shadowing shifts, we had a few days of classroom-based courses which provided no preparation for the reality of our shift. 2 of our residents, Barbara and Thomas, passed away on the same night. Both had arrived less than a week before, and at the time I couldn't understand how either of them could be considered fit for hospital release. Thomas was passing blood clots in his stools, and Barbara was evidently frail and ailing. Her gentle smile drooped to one side, and she didn't talk much, so when she was put on end of life, it came as no surprise to me, but when she died, it still came as a shock. Can you go in and make Barbara look nice for her relatives? No training, no advice, nobody else available to do it. I thought of how my mum looked when I saw her laid out in the chapel of rest, and I tried to do the same for Barbara. With a colleague beside me, we washed her face, brushed her hair, put on a housecoat, closed her eyes, and pulled up the sheet to just under her chin. Later on, I sat and drank a quick coffee on my break and hoped I'd done enough for her and for her relatives.
Let's get some more thoughts now from Joyce Pinfield from the National Care Association, and we're joined too by Anita Astle, who's Managing Director here at Wren Hall and who you saw earlier in Julian's report. Anita, to you first, thank you very much for having us after what I know has been a really difficult time for you. I wonder if I can put one of the viewers' general questions to you, but absolutely applies here. Are you confident that you'll be in a position to cope this winter if there's a second wave?
We're doing everything that we can possibly do. We're training our staff, we're checking their competency to deliver care and follow the correct procedures, and we're making sure we've got all the best PPE that we can possibly have, and we're making sure that we are ready. So yes, I am confident.
Joyce, to you, Kate Cameron's asked on Twitter, why did care homes not all follow correct procedure and isolate everyone coming into care, whether from NHS or not, if they didn't have a negative test? Contingency planning should have covered this, she says.
We all started off with business contingency plans, of course we did, and we were all totally aghast. We felt it was a slap in the face when Boris Johnson accused us of not following the guidance. Admittedly, he did say not all care homes were, but we also felt that that was a tremendous slap in the face. We have been following guidance. Indeed, many care providers up and down the country locked down their homes to visitors, started isolating residents, particularly those coming from hospitals, without testing, because, as you know, we were left behind at the beginning. So the NHS were concentrating on making room for COVID patients. And so admissions into care homes were taken, I believe, up to about 25,000 without testing. And so we were left in this position of untested residents coming into the care facilities in the very early days with no guidance from the government at that time. We were locking ourselves down away from visitors.
And you felt you weren't on a par with the NHS?
Felt we were not on a par. We have been totally disregarded, and I do feel that the NHS and social care should be on a parity. We are supporting the NHS. Indeed, they could not function quite so well without social care supporting them, and of course we do that at far less cost than the NHS.
OK, thank you, Joyce. That's it for now, at least on Channel 5. We're going to carry on this discussion with Anita and Joyce live on our Facebook page, putting more of your questions to them. So if you want to watch that, head to Facebook and search for C5 News. Remember, you can also submit your own questions on there and on Twitter. Just use the hashtag COVID Care Home Crisis. We'll hopefully see you in a couple of minutes. But for now, from me and all of the team here in Nottingham, thanks for your contributions and thank you for watching. Goodbye.